Great, thank you very much. All right, well, hello everyone and welcome. My name is Natasha Clark. I'm an international student advisor with the Internationalization Office at the St. John's campus of Memorial University. My pronouns are she and her, and I'd like to recognize that I'm an uninvited settler in the ancestral homelands of the Beothuk and the Mi'kmaq. We're so happy that you could join us as a new student starting in the spring of 2024 semester. It's very important that you have a good understanding of health insurance and the healthcare system in Canada. And so that is the purpose of today's session. So I'd like to begin with a land acknowledgement. We acknowledge that the lands on which Memorial University's campuses are situated are in the traditional territories of diverse Indigenous groups, and we acknowledge with respect the histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province, and we encourage everyone to reflect on the lands where you're located and the Indigenous people for whom these lands are traditional territory. So a land acknowledgement is something that we do at Memorial at the start of many of our sessions or gatherings as a way to recognize the fact that as a colonial, as a settler institution, we are located on the lands of Indigenous people, and Canada has a dark history in terms of colonization and the genocide of Indigenous people whose lands were essentially taken away from them. They were never formally given up, but settlers came in and really took over the land and have really devastated and continue these populations to have a lot of intergenerational trauma and impacts as a result of colonization and that settlement. And so Canada is working towards trying to reconcile with Indigenous people and reconcile this history. And so it's important as part of that process to bring truth, right? To talk about the very dark history that Canada has that hasn't been talked about for many, many, many years. And that many Canadians are still learning about. So that's why we do it here as a way to help to work towards that reconciliation and to recognize that truth. And I would certainly encourage you, as part of your journey in being in Canada, if you are interested in educating yourself more about this, there are a lot of great resources even within the institution. We have the Indigenous Student Resource Office, and there's certainly ways that you can get some more information about that. So before we begin to talk more about the health insurance, I just want to let you know that we will have a question and answer session at the end of the presentation. So I do kindly ask that you save your questions till the end. And there is a Q&A function here where you can go to put those questions as opposed to putting them into the chat. And we'll talk about how to do that. But we just ask at this point that you hold your questions till the end, because we do have a lot of information we want to cover. But in the meantime, even though you're going to be holding your questions till the end, it is designed to be hopefully a little bit interactive. I know it's hard to do that sometimes on virtual video meetings, but we do want you to engage with us. So in the meantime, if you have questions or concerns, not about the topic, but just about your experience here in WebEx, please connect with us in the chat. And we will be at times pausing, and I'll be kind of quizzing and testing your knowledge. So I would really encourage you to engage with us in the chat at that time. Okay. So the purpose of session today is really to be able to give you some information so you can begin to develop an understanding of the different types of health insurance that may be available to you as an international student at Memorial. So we'll talk about the foreign health insurance. We'll talk about MCP, which stands for Medical Care Plan, and we'll talk about the Student Union Insurance. So by the end of the session, you should be able to describe the difference between those insurances. You should also be able to identify what may make you eligible to opt out of or cancel that foreign health insurance, and then describe again how you would go about doing that. There is a deadline to do that for the spring semester, and we'll talk about what that is. So you should be able to recognize and know what that deadline is. And in addition to just kind of talking about health insurance, we want to talk about services that kind of come as part of that health insurance. So GuardMe being the foreign health insurance provider, there are specific services that as a holder of that insurance you could avail of, or as a student of Memorial. And then we'll also talk about ways to seek medical care, because the healthcare system in Canada is no doubt quite different from perhaps, or maybe even just slightly different than the healthcare system that you're coming from. And so it's important to know how to navigate that, right? Because it can be quite complicated. So health insurance is something that we think you should have a basic understanding of when you're starting out your studies. Having that basic understanding will really help you to navigate the systems and to be able to know when to ask questions or as you go through your journey here at Memorial. And health insurance is something that can be quite complicated. Because again, it's so intricate. There's lots of players involved, and there's all different kinds of health insurance. So we will be talking about 3 types of health insurance in particular. That is the foreign health insurance, which is provided by a company called GuardMe. Medical Care Plan, or MCP, which is a health insurance that comes through the government of Newfoundland and Labrador. So that's the provincial government here. And we'll also be talking about the Student Union Health and Dental Plan, which is currently with a company called Green Shield. And health insurance is important because it helps to cover the cost to seek healthcare. And healthcare in Canada can be very expensive, right? People may talk about how Canada has a public healthcare system, which is partially true. That's the MCP. That's where the government will pay for a certain level of healthcare for its residents, but it's not a system where everything is covered, and it's certainly not a system where everything is necessarily easily accessible, right? Canada certainly at the moment is going through a healthcare crisis in that there are a lot of issues in terms of the system understaffing, which can cause people difficulty to get access to healthcare. So it can be difficult to navigate such a system anyway. It can be particularly stressful given the strains that are currently facing some of the systems in Canada. So that's not necessarily meant to scare you. It is meant to just be realistic, to manage those expectations, and then to move on from there to equip you with information and resources that can help you to address these challenges. Because health insurance companies, healthcare providers are trying to figure out ways that they can help improve access to the healthcare. Okay, and health insurance is not healthcare itself, but it's something that can help to cover the cost of seeking healthcare. So if you have to see a doctor or fill a prescription, there are costs associated with that. If you had to have a diagnostic test, right, these can all be very expensive, from tens of dollars to hundreds of dollars to thousands of dollars, depending on the healthcare that you need. So insurance is really important to be able to cover portion of that cost. No health insurance is going to cover everything all of the time. So most people will have healthcare expenses that they have to pay for out of pocket, but it's certainly better to have the health insurance that will cover the majority of things, so that you pay the cost of the health insurance and then the health insurance pays the cost of the healthcare. So it really helps to manage those costs. So not every insurance is going to cover everything all the time. And so that's why it's important, I think, to look at these 3 types of health insurance coverages and to explain how they're different, what they might cover, what they might not cover. So the first one we're going to talk about is the foreign health insurance. And this is currently provided by a private insurance company called GuardMe. And private insurance just means that it doesn't come from the government. It comes from a business, and as such, costs are associated with it, right? As private industry and for-profit business. So the foreign health insurance is what we call the plan at Memorial. So if you look in your student account, you'll see that you're charged the foreign health insurance fee. But the provider of that insurance is GuardMe, and our provider can change. We've been with GuardMe for a long, long time, but there are other companies out there, and sometimes, that can change through the course of your studies. Foreign health insurance is mandatory. So that means that all registered international students at Memorial University of Newfoundland have to have this insurance. And so when you become a registered student, so you register for your courses or you register for your graduate program, you will see that you are being charged all kinds of things in your student account. So you're being charged tuition, you're being charged a recreation fee, you're being charged student union fees, student services fees, and you'll also see the line item of the foreign health. And so that is managed out of our office, out of the internationalization office, and the provider of that insurance is GuardMe. And because it's tied to your registration, and registration happens every semester, it is a semesterized based insurance. So it's charged every semester you're a registered student, and the cost is $261.59 per semester. And that's our current rate, and that rate is good for another year or so, I think, until we maybe have to go and look at our contract with our provider. Now, if there's a semester that you are not a registered student, you will not be automatically charged or placed in this insurance. So it's important for a student who may take next summer semester, if they're an undergrad student, they might not be registered, but they might stay in Canada and try to work. Well, if you're not registered, you likely don't have any insurance through your university. So you need to then opt into insurance. So do something to purchase insurance. And there is a way you can do that with GuardMe. So the first thing I think is very important to recognize is that it's mandatory for all registered students. So as soon as you become registered, you're charged this insurance coverage. But if you're not registered, it's not charged. Okay. And you don't then have the coverage. Now, the next important thing to know about the foreign health is what type of insurance coverage it is, right? As I said, no health insurance plan is going to cover 100% of everything all the time. Now, I describe the foreign health insurance as a comprehensive emergency medical insurance. Comprehensive means that it covers many stages of your healthcare. So if you're not feeling well, your first step may be to go visit a physician in their office, right, for an assessment. There are costs associated with that visit. That physician might then refer you to undergo some diagnostic testing at the hospital, and there's costs associated with getting an X-ray or an MRI or something like that. Or they might write you a prescription that you then have to take to a pharmacy to get filled. And so there's costs associated then with the pharmacy to dispense that medication. So GuardMe is designed to cover these various stages of your healthcare. So the doctor's visit, the prescription medication, the diagnostic testing. But it is primarily designed to only cover those things in the event of an emergent situation. So emergency may sound like something that's very dire and you need to see a doctor right away, and certainly it is. But when we say emergent, really what that's referring to is a new condition that is just emerging that requires the immediate relief for pain or suffering. So it's not something that, doesn't require medical, attention. It's not just for, just checking things out, right? And it is then only for medical services. So often we differentiate between health insurance and dental insurance. And the foreign health is not a dental coverage, but it does have emergency dental coverage, meaning if you had a dental accident, like a tooth was chipped, or if you had extreme dental pain and maybe had to undergo a root canal, there is a level of coverage there, but it's not your typical dental insurance, which would cover cleanings and regular checkups. So the foreign health is a comprehensive emergency medical insurance Okay, so it's primarily for emergent situations. So those things that are new that require immediate relief of pain or suffering. It could be something so serious as to bring you to the emergency room, or it could be an infection where you have to see a doctor in their office and get a prescription, say, for antibiotics or something like that. So it does not cover what are called pre-existing or chronic health conditions. So if before coming to Memorial, you had a health condition that was existing, or you have a chronic condition, or you develop something that requires treatment more than like a 60-day period, right? That kind of goes on. Foreign health will not cover that unless that chronic or pre-existing condition requires medicine or doctor's visits that they deem to be medically necessary. In that case, there can be some coverage under our non-emergent benefit for up to $10,000 a year. So it is an insurance that is primarily meant in case something happens, bad happens, but there are certainly aspects of the policy that will cover things that are non-emergent in nature. So we have that non-emergent rider. There's also, it will cover like one physical exam annually. It will cover you up to $120 to see an optometrist to get your eyes tested, but it's not going to cover the glasses or contacts, right? There's also diabetic supplies, right, which can be covered, even though, of course, diabetes would be a chronic health condition. So there are aspects of the plan that are non-emergent in nature, but it's primarily meant for in case something happens. It's also certainly designed for people who are not normally residents in Canada, right? You're coming here temporarily. So it does have this this repatriation or burial benefit. So, you know, if the absolute worst were to happen and you were to pass away in Canada, it can help to cover the cost of burial or transportation of your body back home. Or if you became hospitalized in Canada for a period more than 7 days, there's a family transportation benefit. So they can help, you know, to cover the cost of a family member coming from abroad to be with you here. So that's a little bit in a nutshell about what the foreign health insurance through Garden is, what it covers, and how it's mandatory and how it's charged to you automatically when you are a registered student. So now we're going to move on to talk about MCP, or the medical care plan. So this is a different type of health insurance. And MCP is public health insurance, meaning it's a public service that's offered through the government of Newfoundland and Labrador. So it is not from a private company, and it is not administered by Memorial. It's not affiliated with Memorial University at all. It comes as a service through the government of Newfoundland and Labrador. It is free, so you do not have to pay to have this coverage. And the type of coverage is different. So our foreign health is our comprehensive emergency medical plan. I would call MCP kind of your basic healthcare plan. And so what MCP is designed to cover is the cost of a medical appointment, as well as most hospital services. So it will cover the cost for you to see a physician or a specialist in their office, which it would be a medical specialist. So it doesn't cover dentist or optometry, right? Or other paramedical services. And it will cover many hospital services. Like if you had to make a visit to the emergency room, there's a cost associated with that visit. If you had to get diagnostic testing, if you had to be admitted to the hospital, if you had a certain surgical procedure that was done in the hospital, MCP would cover that. And it covers those things no matter what the reason, right? So there's not exclusions for pre-existing condition. If you wanted to see your doctor to discuss whatever it is, you know, it's something that MCP can cover. So it's really designed to cover what is the most common form of healthcare that people seek, which is that visit to a physician, as well as the things that are most expensive, right? Which are those diagnostic testings, those visits to the hospital, admissions, and that sort of thing. So very different from the foreign health in that it comes from the government, there's no cost in what it covers. It's also very different from foreign health because it's not automatic, right? Just because you're a registered student doesn't mean you get MCP. You have to first be eligible for MCP, and then second, you have to make the application for MCP. So not all international students will be eligible for MCP. Most are, but not everyone is. So to be eligible, you have to be a full-time student, and in our case, studying at Memorial University. You have to have a valid study permit for at least 1 year, and you have to be a resident of Newfoundland and Labrador. So that means you're living here and you have the intention to live here for the majority of the year. Right? It's okay if you go home for a visit for like a month or so, but you have to intend to reside in the province of Newfoundland and Labrador for the majority of that time. So if you are a student who has not yet arrived in Canada, right, you don't know yet if you will be eligible for MCP because your study permit has not been issued. Right? Your study permit's not issued until you enter Canada and come through that port of entry and provide your letters that confirm you've been approved for your study permit. It's not issued until that time. So you have to then, when you arrive, note how long is your study permit valid. If it's valid for at least the next 12 months, well, then you meet that criteria to be eligible for MCP. The other is, of course, you have to enroll in courses or in your program at Memorial and be a full-time student. And then, of course, you have to travel then and be here and establish your residency in NL. But if you meet these criteria, you can, shortly after arrival, apply for MCP. So you don't have to wait a certain number of months. You know, in your first week or two even here, you can apply for MCP if you're eligible to do so. And when you're making your MCP application, you have to complete an application form, and then you have to provide proof that you are eligible. So in order to confirm that you are a full-time student, you need to have that proof of enrollment. And MCP requires that that enrollment proof be issued within the last 30 days. So generally, you'll get an email confirming your enrollment, and that would be okay. Or you can request an enrollment letter through your Memorial self-service, and that has to be issued fairly recently. Then you have to also present a copy of your study permit, which demonstrates its validity for a year, and a copy of your passport to confirm your identity. So if you're eligible, you absolutely should apply. We strongly encourage it. And I believe we will be setting up some clinics for students once you arrive on campus in our office to be able to apply for MCP. And if Bahar has not already provided you with that information, we certainly can do that at the end of the session. But if you can't come to one of those MCP clinics, you can still make your application by sending it in the mail or dropping it off to the MCP office. Okay. So MCP is free public health care from the government of Newfoundland and Labrador. It covers you to see a doctor or different services in hospital. Not everybody will be eligible. To be eligible, you have to meet these criteria on the screen. And if you're eligible, you certainly should make that application. And thank you for Bahar for popping that into the chat, which gives you the schedule for the MCP clinics on campus. Okay. Now, MCP insurance is great, but it's still not enough insurance, right? So just because you have MCP doesn't mean you can have no other insurance. So you can opt out of the foreign health, which you also have as a registered student, right? Most people in Canada, if they can afford it, will have insurance more than just MCP. And as a student of Memorial, you are required to have more insurance than just MCP. Even our Canadian students have to pay health insurance through the institution as part of their enrollment. It's just what the Canadian student is charged automatically is different than what you as an international student is charged, because our Canadian students will have MCP, right, based on a different set of eligibility, but not all international students will get MCP. So because of the fact that our Canadian students have MCP and many of our international students may get it, there are other health and dental plans at the university, and these ones are managed by your student union. So that's a third type of health insurance we're going to talk about. So your student union is a group of students to which you pay union fees as part of all your student fees in your account. And they are here to represent your interests and your rights and responsibilities as a student. So they do all kinds of work, advocacy work, and campaigns. And so certainly there are many opportunities for you to get involved with your student union. You pay a union fee to be a part of that union, to be a member, and they're there to serve you and represent your student interests on campus. So these student unions also manage a health and dental plan. And there are different student unions, and which one you are a member of depends on your level of study and your campus of study. So if you are a graduate student, regardless at which campus you are a student, you are a member of the GSU, or the Graduate Student Union, okay? If you are an undergraduate student, then if you're an undergrad student at the St. John's campus, your student union is MUNSU. If you're a diploma student at the Marine Institute campus, your student union is MISU. And if you're an undergraduate student at the Grenfell campus in Corner Brook, your student union is the GCSU, the Grenfell Campus Student Union. Okay. Now, each of these student unions have a health and dental plan, and all of their health and dental plans are with a company called Green Shield. But the plans that each union has is different, and the cost of each of those plans is different. But you would only be eligible for the plan that's administered by the union you are a member of, okay? So our graduate students, if you're a full-time graduate student, whether you're international or Canadian, you automatically have the GSU dental plan. So if you're a registered student, you're looking at your student account financial menu, you see all your charges, you'll see the foreign health insurance there, right? Because that's what you get automatically as a registered student. But you'll also see the GSU dental insurance there. So you do have separate dental coverage. Our undergraduate students don't automatically have that dental coverage. But if you obtain MCP and you're eligible to opt out, then we can transfer you to the student union plan. So we'll talk about that, right? So this is why we're talking about the student union health and dental plan, because you may have the opportunity, if not in your first semester, later on to maybe make the switch. But MCP is not enough. You need to have something else. So if you opt out of foreign health based on MCP, then you're going to the student union health and dental plan. And these plans are designed to supplement MCP coverage. So it doesn't cover the cost of a doctor or to go to the hospital, because that's covered by MCP. What it covers are things not covered by MCP. So prescription medication, paramedical services. So maybe that eye checkup, maybe the glasses or contacts, other paramedical services like chiropractor, physiotherapy, massage therapy. Okay. These are the kinds of things that can be covered by a supplemental plan. Now, the coverage is very different, right? So the students who have MCP may have the option, like I said, to opt out of the foreign health and switch to the student union plan. And certainly there are some benefits that you gain from doing that. One of the primary benefits that you gain is that the student union health plans typically don't have those exclusions to pre-existing or chronic conditions. So they will fill a prescription that might have a refill every month, for example, regardless of the reason why you're taking that medication. Now, remember, not every insurance is 100%. So a lot of insurance plans will have a maximum in the year that they'll cover. And many insurance plans will not pay for the full cost of the medication. It might be 80%, and then you have to pay the other 20%. So say if you get medication that costs $10, which would be very unlikely, but they would pay maybe $8 and you'd have to pay $2 to the pharmacist before you could get that medication, right? Keep that in mind. But that's a benefit is that if in terms of switching is that you don't have that exclusion to pre-existing conditions. But there are certainly things too that you would lose by switching out of the GuardMe insurance. And that's because, as I mentioned, GuardMe is designed for people who are not permanent residents of Canada. So it has that repatriation, that family transportation benefit if something really terrible were to happen to you. So that you would be giving up, right? As well as the different services that GuardMe has, which we'll talk about. Okay. So this graduate student union says if you end up getting your MCP, they really strongly advise you to opt out and get into their plan. So they want anybody who's eligible into their plan. In terms of our undergraduate students, you don't necessarily have to. It's not that same language, but you can look at it and kind of make a decision if you want to switch the insurance. Because your student union health plan is tied to your MCP, and MCP only covers you in the province, you can get some out-of-province coverage in some respects, but generally it's limited to the province. If you intend to kind of travel, or you might be somebody who's going to have work terms or go work like in Ontario for the summer or something like that, the foreign health might be the better thing to stay in because it has that coverage across Canada, is not necessarily tied to your MCP. Okay. All right, so I've talked a lot and for a long time, and all we've done so far is just kind of explain the differences in the three health insurances. So I want to pause now and just get you to engage with me so we can see and kind of test your understanding. So please engage in the chat. Let me know if you think this statement is true or false. So you can just type in really quickly true, or you can type in false. So number one, foreign health is optional for registered international students. Is that true or false? Can everybody locate the chat here in WebEx? It's a little speech bubble in the controllers. You can open that up and type in your response. All right, there we go. So we have a response. Perfectly false. And that's exactly right. So it's not optional, it's mandatory. And the way we make it mandatory is as soon as you register, it just automatically has that charge in terms of on your student account. All right, number two, let me know if you think this is true or false. Foreign health only covers you in Newfoundland and Labrador. Is that true or false? Anyone? I'm seeing some people use their reactions, but I'm not seeing anything in the chat. So yeah, there we go. Perfect. So this one is false. That's right. So the foreign health insurance coverage that is with GuardMe will cover you anywhere in Canada. And it also will cover you sometimes out of country, right? But it depends on the reason you're going and where you're going and for how long. Okay. All right. MCP only covers you in the province unless you apply for and are approved for out of province coverage. So that's kind of the difference there. Number three, you can apply for MCP before you come to Canada. Is this true or false? All right, thank you so much, Linda. That's right, it is false. So the reason why you can't is because you have to be, one, a resident of Newfoundland and Labrador, so you have to move here first. And two, you have to have a valid study permit for at least 12 months. And that study permit is not issued to you until you enter Canada, right? You may have applied for it before coming. Of course, most of you will have to do that, and it can be approved, but you don't physically get the study permit until you get here. Okay. So we'll move on then to the second thing we wanted to cover in this session, which was about opting out of the foreign health insurance. So the foreign health insurance is mandatory for all registered students, right? So it's automatically applied. But if you're eligible, you can opt out and cancel that fee. So you have to take action to opt out. And there are very, very few cases where you would be eligible to opt out. Number one is if you have a valid MCP and you want to transfer to the student union plan. Okay. Number two is if you are studying outside of Canada. And three is other eligibility to opt out. So we'll talk about that, but we don't typically accept alternate forms of health insurance to opt out, but there are a couple that we do accept. One is for our students who may be coming through the Libyan Scholarship Program, and another is if you are a refugee claimant and you're covered by the Interim Federal Health Care Plan. Okay, but if you have come with insurance like from your home country or something like that, it's not reason to opt out. It's just those couple of large group policies where we have groups of maybe some sponsored students who are coming through. Okay, so having MCP might allow you to opt out and transfer to the student union insurance, but you will likely not be able to do it in your first semester. And that's because the validity of your MCP does have to align somewhat with the coverage period of the foreign health, okay? And the foreign health insurance for registered students in the spring will cover you from May 1st to August 31st. All right. And then if you're registered in the fall, it's September 1st to December 31st. So if you keep your registration, you don't have a gap in your coverage. So those are the dates of the foreign health for the spring. So in order to opt out of it based on having MCP, that MCP you have has to be valid on or before May 1st as well. And generally that doesn't necessarily happen for you if spring is your first semester, because you might not arrive in Canada until after the first, right? So it's important to note that a lot of students, it's not an option in their first semester, although we still would really encourage you to apply for the MCP, but it could be an option for you, say in the fall semester, to make the switch, right? So you have to be a full-time student and your MCP has to be valid on or before May 1st and valid beyond May 20th and subject to renewal, okay? Once you kind of get registered in the spring semester, within about a week, you should get an email then from GuardMe to say, you know, welcome to GuardMe. You might be eligible to opt out if this or this or this. And once you get that email and you are eligible to opt out, then you can go online to GuardMe at guard.me/MUN to complete the opt out online. And the deadline is May 20th, 2024. Another reason why you could opt out is if you're studying outside of Canada. So if you are registered in online courses for the spring and you don't intend to travel to Canada, then you want to opt out for sure, and you want to do it before the deadline. And so same thing, you'll get that email from GuardMe, you'll follow the link, and you'll do the opt-out. Opt-outs for this reason are really just a one semester opt-out, whereas when you opt out based on MCP, the opt-out is good till the end of the academic year. Now, our spring is our last semester in the academic year. So everybody, if you opt out now, will have to do it again in the fall semester. And as I mentioned, the other eligibility to opt out. So if you're a sponsored student with coverage from the Libyan Scholarship Program, or you're a refugee claimant with the federal health insurance through the Government of Canada, those can make you eligible to opt out, but other alternate insurance is not. And our deadline to opt out for spring 2024 is May 20th, 2024, which is 2 weeks from the start of the semester. And it's the same day to add and drop your courses. All right. So let us just go through another quiz quickly. So please engage in the chat and let me know if you think this is true or false. 1, having MCP is adequate health insurance. Is this true or false? Yep, that's right. It's false. So as a student of Memorial, you have to have more than just your MCP. And I'm going to change the wording of this one. So I can opt out of the foreign health in June. Is that true or false? So this one is actually false because you have to remember the opt-out deadline. And I changed it on the screen. It said October, but I haven't said June. Our deadline is May 20th. So no, you can't opt out in June. So just pretend this is that instead of October. And 3, I have insurance for my home country, which means I can opt out of the foreign health insurance. Is that true or false? This one is false because we only accept these other forms of coverage. MCP, you're outside of Canada, you have the federal health, or you're a Libyan scholarship student. Okay. Now, for those students, we've talked about, your health insurance as a student, and that coverage is for you. The cost that you pay for that insurance is coverage for you. But if you bring your family member, so a spouse, dependent children, then you will want to possibly get insurance for them. And I certainly would encourage it because, as I said, healthcare can be very expensive. And as much as you think you might not need it, if you break a bone, I mean, it could be hundreds to thousands of dollars, right, out of pocket. So in terms of what are your family's options for the different insurances that we've talked about, the foreign health, the MCP, the student union, you can include your dependents on your MCP application. So a dependent would be a spouse or a dependent child. Now, if you are eligible for MCP and your dependent has a valid immigration document that's valid for at least the next 12 months, then they can be included on your MCP and be eligible for MCP, but both have to be true. You yourself have to be eligible and get MCP as the primary applicant, and your dependent has to have an immigration document. So a work permit or a visitor permit or a study permit for school age kids, whatever it is, has to be valid at least for 12 months. So if they're eligible, you include them on your MCP application and you provide a copy of their passport, a copy of their immigration document, you provide proof of the relationship, so marriage certificate, birth certificate, and then you each should get the MCP card, okay? So if you and your dependents, if you all get MCP and you decide you want to transfer your insurance to the student union plan, then you can do that and then contact the student union directly if you want to add your dependents to that insurance. Because when we switch you over, we change the fee on your student account, but you're only charged the coverage for yourself. If you want to pay the coverage for other people, you'll have to go to the student union to do that, okay? Now, if you stay in GuardMe, so you don't opt out of the GuardMe based on having MCP, then what will happen is after our deadline of May 20th, we'll finalize our enrollment. So we'll make sure, if you haven't opted out, we're going to enroll you in the foreign health. It'll probably be towards the end of May or by June 1st or 2nd that you would then get another email from GuardMe with your policy details, right? So it will have information about how to access your GuardMe account, how to print your healthcare access card, what your healthcare access card number is. So from the time you get that email towards the end of May, very early June, you have 10 days whereby you could go to GuardMe and purchase insurance for your family and have them retroactively added to May 1st, okay? Now, it also happens sometimes that the student gets MCP and switches their insurance, and the family member comes later and ends up not being eligible for MCP. And so those family members could still get the GuardMe coverage by going to guard.me/MUN, but it's a slightly different policy than if they're with somebody who's already in the GuardMe plan. Okay. So that's a little bit of information for our students who may have accompanying family members. All right. Now, GuardMe, as I mentioned, is a provider of the foreign health. So as a new student, you most likely will be remaining enrolled in GuardMe, at least for your first semester. And then in the fall, you may have the option to switch out. GuardMe has different services. So they have an online account. So you can go to their website. And as I said, like end of May, early June, you'll get that information about how to create your account. So you can submit a claim, you can print your healthcare access card. The full version of the policy will be there. So there'll be all that information. GuardMe also has a program called Mobile Doctor. And so Mobile Doctor is just for students who remain enrolled in GuardMe. And this is where you can book an appointment with a physician for a virtual consultation. Okay. And this can be quite helpful because it can be sometimes difficult to visit a physician in their in-person clinic or to get an appointment with a physician here. And so this is just another option where you might be able to get a sooner appointment and many times they can diagnose certain things even virtually, and they can write prescriptions and they can send a prescription to a pharmacy of your choosing, right? To then fill and you can go and pick up. So Mobile Doctor is something that is available only to students who stay enrolled in the GuardMe plan. GuardMe also has another program called Keep Me Safe. And this is a program that is available to all students at Memorial University. Our graduate students have access to it, but a little bit differently than our undergraduate students do. And what Keep Me Safe is, it's a mental wellness student support program. So it's meant to provide counseling services and support to students who may be undergoing mental health challenges. It could be distress, roommate issues. It can get you connected with a counselor to be able to give you that support to work through some of those very stressful life events. And it is counseling services that are available 24/7, and you can do them through chat, you can do them through virtual phone call, a phone call or a meeting. You can also sometimes get connected in person with a counselor, and they can match you and provide counseling services in a variety of different languages, and they can also match you based on maybe like a culturally appropriate counselor. So it really is a wonderful service for students, and you can download an app and it's quite as simple as that. The other thing you may see from GuardMe as you are here on campus is our campus ambassadors. So it's through GuardMe Cares. So they will host different events or information sessions, and they're there to help connect you and answer questions about GuardMe. Okay. All right. So now we'll just check in again quickly. So if you want to just type into the chat if you think this is true or false. Number 1, to make a claim, I can only do so by mail. If you had to claim something through GuardMe. So this one would be false because we mentioned that you can make a claim online. Number 2, with GuardMe insurance, I can only see a doctor virtually. Is that true or false? So that's false. That's right. You can still see a doctor. It's just you have this additional benefit of being able to use the Mobile Doctor. And number 3, I need to be enrolled in GuardMe insurance to avail of the Keep Me Safe program. This one is also false since all of our students have access to that Keep Me Safe. Okay. All right, so now we're going to move on to talk about seeking health care. All right, so of course we talked about Mobile Doctor, but you can see a physician in their clinic, and we'll talk about that. Now, in Canada, there's a distinction between like a primary care physician and a specialist. Okay, so it's not possible to see a medical specialist without a referral from a primary care physician. So if you're not feeling well, or if you have even like a skin issue, you can't necessarily just go to a dermatologist. You'd have to go to your primary care physician first, who, if they feel they can't treat you, would do a referral to a specialist, to a dermatologist, as an example. Primary care physicians are called also general practitioners, or a GP, or a family doctor. That's probably a very common term. Okay. And as a student of Memorial University, you have the Student Wellness and Counseling Center, or the SWCC, which is located on campus. So it's in a building called the University Center. It's on the 5th floor. In the Student Wellness and Counseling Center, you have a team of primary care physicians and a nurse. You also have a team of counselors, right? So the counseling services are provided without needing insurance, right? So it's not covered by insurance. It's just a support that's given to you as a student of Memorial. So you have, of course, the Keep Me Safe, which can access you to counseling services 24/7, but you also have a team of counselors, Monday to Friday, 9 to 5, that you can connect with them and book an appointment with. Okay. So the Student Wellness and Counseling is not just primary care physicians. It's also the counseling center. So if you need to see a primary care physician, you can make an appointment at the clinic at the Student Wellness and Counseling Center. And this is really wonderful because that's your family doctor. That's your family doctor clinic. For people in the general community in St. John's, for example, it's very difficult to get a family doctor. This is part of the healthcare crisis that Canada is undergoing, is a lot of people are without a primary care physician. So this is something you don't have to worry about. You already have a primary care physician as long as you're a registered student at Memorial. And so you can book an appointment and see that physician and then discuss your health concerns. And if they deem it necessary, then you can book it, that they can refer you to a specialist if necessary. And they would have to be the ones to order like diagnostic testing, right? You can't just go for blood work without a doctor requesting it. You can't just go for an ultrasound or an x-ray. A doctor has to request it. So your first point of contact would be that primary care physician. Now, there are also other healthcare professionals, right, who are not, medical doctors. So we call them like paramedical, like a chiropractor, physiotherapy. Sometimes your primary care physician might refer you to those services as well, but you don't have to necessarily be referred to just go to a chiropractor or physiotherapist. Of course, unless you need it, it's not necessarily going to be covered by insurance, right? But like as well, same thing with an optometrist to get your eyes checked, right? Or a dentist. Those types of healthcare professionals are much easier, I would say, to access. So if you had dental insurance and you wanted to connect with a dentist, then you could do that a bit easier. Okay. Now, where you would go, we've already talked about the Student Wellness and Counseling Center. There are external clinics as well, right? Like, I am fortunate in that I have a family doctor, but it is very hard to find one, right? So you don't have to worry about that. And there are other clinics that, even if you're not a patient of that clinic, they do walk-ins. So there are a couple that are operated in the city. There's also then the emergency department at the hospital, and the primary hospital in St. John's is located basically on campus or just adjacent, because our Faculty of Medicine and Pharmacy and Nursing, it's a teaching hospital. They operate out of there. So they would have an emergency department as well as a couple of other hospitals in the city. And you would present to emergency like if you just couldn't wait, right? You couldn't get your appointment. It was necessary. You needed that medical attention right away. That's really what the emergency department is meant for. Now, unfortunately, because of the fact that many people don't have that access to primary care physician, sometimes they visit the emergency room for those reasons where they would normally be able to wait and get an appointment with a primary care physician. And the emergency room is not designed for that. But because of that issue, sometimes you see wait times can be very long. Now, I certainly can't advise you whether or not you can wait to see a doctor or if you need to go to the emergency department. That's something you would definitely have to make that call yourself. You know your body and the symptoms you're experiencing. And if you're not sure if this is something that could wait, until Monday when the Student Wellness and Counseling Center is open, then you can call the health line. So if you call 811, you can get connected with a nurse and you can explain your symptoms and issues, and they can help to advise you on what to do. Okay. All right. So I really love my questions that have a false answer, and I think you've probably figured that out. So just in the interest of time, we'll just go through this quickly. So it is easy to get a family doctor outside of the university. This is false. It is not. You're very fortunate to have the Student Wellness and Counseling Center. So as much as this health insurance stuff may be complicated and a bit of a headache, at least you can be reassured that when you get here, you need to seek a physician. You can do that through on campus. And two, I can directly make an appointment with a specialist. So that's false as well. All right, so that brings us to the end of the formal presentation. There's still lots of time, certainly, if you have questions. And if you want to ask your question, you can certainly do so through the Q&A.